All right, we're also following the president's comments as well as we look at this drama unfold on Capitol Hill with the health care rework, the repeal effort that the president says is still moving forward, and he is still very confident. This next fellow, though, has his serious concerns about it. I'm talking to Molina Healthcare CEO Dr. Molina, opposed to the original GOP health care plan. Hasn't seen the details of any reworks of those plans, but the doctor joins us now. Good to have you, sir.
Thanks for inviting me.
Your concern with the Republicans were coming up is that it would hurt lower-income beneficiaries to the health care plan, the Obamacare plan, by going after Medicaid funding and the financing that a lot of poor folks or those not as wealthy get to maintain their insurance. That's the gist of it, right?
That's correct.
And
if you look at what the CBO said, 24 million people would lose their insurance coverage under the proposal that was recently withdrawn from Congress.
So what do you want to see as Republicans look at this again?
Well, I think there are two issues here. One is the marketplace and marketplace stability. I think that Congress needs to give themselves some time to develop a bipartisan solution. And the best way to do that is to continue the funding for the marketplace for 2017 and 2018. And that means funding the CSRs, which are subsidies that help low-income people pay their copays and deductibles. And then we need to address Medicaid. And the issues around Medicaid are the high costs in Medicaid and the fact that so many high-cost patients are in a fee-for-service environment where there's no oversight or management of their costs, and the program has a lot of fraud and abuse.
Would you ever consider, Doctor, regardless of whether it's Obamacare as it stands now or a rework program under what Republicans are considering now, just abandoning York State, period, get out?
Well, yes, actually, we would. If the CSRs are not funded for 2017, we would consider that a breach of contract, and we would probably withdraw from the market in 2017. And 2018, I think you'd see a collapse. These are decisions that can be made by the President and by the House Republicans to stabilize the marketplace, and they need to be done soon because we have to submit our rates for 2018 in May. And without knowing how they're going to fund the program or what's in or what's out, we really can't develop those premium rates.
But, Doctor, it seems that they're not sustainable, or the math isn't sustainable, even as things go now. If Obamacare, the Affordable Care Act, stays in place exactly as it is, wouldn't you face that same dilemma?
Well, there are clearly issues with the Affordable Care Act, and there have been since it was first passed. But what we really need is to buy Congress some time to develop a bipartisan solution. What we saw with the AHCA was a partisan attempt that failed. And you can argue the same thing about the ACA. So what we really need is for Congress to come together. If I were the President, I would fund the CSRs, and then I would go to leaders in the Senate, like Senator Hatch, and ask them to lead a bipartisan effort to reform the health care system.
What's left? Would you leave? I mean, you're in 9 states: California, Florida, Michigan, New Mexico, Ohio, Texas, Utah, Washington, Wisconsin. What would you do with the 1 million or so members part of this marketplace? What would happen next?
Well, about 70% of our members are covered under these cost-sharing reductions, or CSRs.
Right.
We can't absorb the loss in funding. If it's withdrawn, that would basically be a breach of our contract with the government to provide health care, and we would have to give our members notice and leave the marketplace. So it's a very serious matter.
United Healthcare, I'm sorry, sir, but United Healthcare, Aetna, some of these others want to leave for different reasons, that it's financially unsustainable for them. In a different sense for you, much the same. It is possible here that the financial underpinning for the Affordable Care Act, even as it now stands, is in question.
Well, I think that this is really up to the Republicans and the President what they want to do, if they want to stabilize the marketplace and buy some time to create a replacement. Otherwise, you're going to see tremendous disruption, and millions of people could lose their insurance this year. So I'm hoping that cooler heads will prevail.
When you say this year, Doctor, I'm sorry,
agreement.
sir, just want to be clear. When you say this year, that is whether they come up with an alternative plan or not.
That's correct. So the CSRs right now are funded through May. There's a court appeal going on, and the funding is continued while that decision is being appealed. There has been talk about some solution to continue the funding of the CSRs in 2017. But without them, I don't think we can continue, and I think many other smaller not-for-profit plans that are participating, some of the single-state Blue Cross Blue Shield plans, they might withdraw as well. So there's a near-term crisis coming if something isn't done.
Yeah, one way or the other. Interesting, Dr. Mario Molina. Thank you very much for taking the time.